All right, so we're moving on. Still talking a lot about our urinary system. Okay, we're talking about issues in the urinary system because, of course, they can be related to issues in the genitals. So this is what is known as a cystitis. We'll get to discuss what is cystitis, okay, and make progress. So cystitis, of course, is inflammation of the bladder. So we're quickly just trying to look at the pathology, okay. It's basically like the physical distortion that usually comes with this inflammation of the bladder, okay. So cystitis is inflammation of the urinary bladder. Most commonly it is caused by bacterial infection, and its pathology involves mucosal edema, hyperemia, and infiltration by inflammatory cells, okay. So cystitis just is actually a spectrum of bladder inflammatory conditions. So it range from acute bacterial infections to chronic or interstitial forms, okay. So the most common is the one caused by bacteria, especially the one caused by the Escherichia coli type of bacteria, okay. So of course, pathology, we are looking at what you physically see, okay. So gross pathology include mucosal hyperemia, so there's a whole lot of swellings, all right, edema and hemorrhage, okay, ulcerations in severe cases, then purulent exudates, okay. So microscopic, that's like basically you send this thing for histology, what are you expecting to find? So neutrophilic infiltration, of course, white blood cells were coming to fight infections, right? Then chronic cystitis, you see lymphocytes, plasma cells, macrophage are dominant in that. So cystitis cystica, you see fluid-filled epithelial nest known as the Brown's nest. Cystitis glandularis, okay, it's glandular metaplasia of the urothelium, sometimes considered a pre-malignant form, okay, that's like before cancer comes in. So pathophysiology is infectious mechanism, so it's the bacteria that usually ascend from the urinary tract up, okay. So that's basically for infection. Then for non-infectious, usually maybe you got it from irritants, the drugs we're using, some things we're rubbing in the genitals, and all of that, okay. So that's it for the pathology of cystitis.